Everyone, and welcome to today's webinar on equity in agriculture, nutrition, and health research. My name is Janet Hoder, and I'm the Senior Communications Specialist with the CGIAR Research Program on Agriculture for Nutrition and Health, or A4NH. I have a few logistical notes to share with you before I turn things over to today's speakers. First, please note that we will be recording today's session. The recording, along with the slides and a summary blog, will be uploaded to A4NH's website in the next few days, and you'll receive a notification when those materials are available. Second, to minimize any technical issues, we will be receiving questions and comments via this question window. So if you'd like to ask a question, please use that function to do so, and our moderator will share those with the speaker. With that, I'd like to introduce you to today's moderator, Hazel Malapit. Hazel is a Senior Research Coordinator at the International Food Policy Research Institute. She coordinates research, training, and technical assistance on the implementation of the Women's Empowerment in Agriculture Index, or WEA, including refinement and adaptations of the tools for project-level use and for capturing empowerment across the value chain. She also manages and coordinates the integration of gender, equity, and empowerment into A4NH research and conducts research on gender, women's empowerment, agriculture, health, and nutrition issues. Hazel, thanks so much for moderating our conversation today. The floor is yours.
Thank you so much, Janet. And thanks to all of you for joining us today. So A4NH has always had a strong interest in gender, of course, and we know that gender plays a critical role in the pathways linking agriculture to nutrition and health. But we also recognize that there are other dimensions of equity beyond gender that influence agriculture, nutrition, and health. So today it's my pleasure to introduce you to Dr. Jody Harris, who together with her team at the Institute of Development Studies, IDS, have been helping us think through these issues and figure out what this means for A4NH research moving forward. Jody is a research fellow at IDS in the UK with a research interest in the politics and ethics of food systems and nutrition policy. She conducts research into power in societies, including work on equity and marginalization, power in politics, including political science work on policy processes, and power in food systems, including private and public actors and actions, as well as the ethics of intervention into these spaces and ethical drivers of different actors within these systems. Welcome, Jody. Over to you.
Thanks very much, Hazel and Janet. So today the plan is that I would like to tell you about a review of literature that we've undertaken here at IDS. I hope you can see my slides. So the idea was we wanted to see what's out there in terms of agriculture, nutrition, health research, and I'm going to use the ANH acronym for short, otherwise it's going to take a long time to say that every time. So we wanted to see what's out there in terms of ANH research that looks at different aspects of equity. So I did this work with my team, so many thanks to Winston, Becky and Dina for their work on this. And thanks also to Stuart Gillespie and Amanda Wyatt and Hazel at IFPRI, and also Nick Nisbet at IDS for conceptual input into this study, the design and the interpretation. And as Hazel mentioned, the study was funded by the Gender Equity and Empowerment Unit of A4NH. So many thanks for that. So the links and the feedback loops between agriculture, nutrition and health are very clearly hypothesized now in various frameworks and theories, if you think of all those different pathways diagrams out there. And the empirical evidence describing and analyzing and clarifying those links is growing literally by the day. So the Sustainable Development Goals contain targets to improve aspects of each of those issues, agriculture, nutrition and health. And the goals obviously are a kind of roadmap that places emphasis on leaving no one behind in that rush for development. And leaving no one behind implies a focus on equal outcomes, but also on equitable processes in achieving these development indicators. So whereas what's often seen in practice is marginalization and inequities in shaping unequal outcomes, and that limits global and national progress on the goals. So we think there's a need to understand how issues of inequity and inequality are shaping progress on these issues of agriculture for nutrition and health. So in the paper I'm going to present today, we undertook a scoping review of available literature to understand how ANH research is addressing issues of inequity and inequality. And the idea is that we can pinpoint gaps in knowledge that might be limiting action to leave no one behind in those areas of social development. So firstly then, what are equity and equality? And first I want to point out that, like most kind of philosophical ideas, these are contested concepts. I couldn't give you a single definition that everyone would agree with, but I will in the next few slides try and give you a sense of what equity and equality are based on, at least in our view, and how they relate to other similar concepts, because that will help the discussion later. So equity and equality, both of them are underpinned philosophically by moral equality, the idea that all people count and should be treated in different ways as equals. So they are normative concepts. We're saying that people should be treated equally. So talking about equity and equality is value laden. It's based on how we think the world should be. But it's no more value laden than aiming for something like economic growth or human rights, which are also choices based on our value systems. But what it does mean is that different people will prioritize different aspects of equity or equality, or in some cases maybe not prioritize them at all. So this version of a famous picture on the slide shows one essential difference between equity and equality. So where equality focuses on outcome or the sameness of a final distribution, equity focuses on process or the fairness of a just distribution, a fair distribution. So equity and equality aren't the same, but they're not mutually exclusive. One chooses to focus on outcome and the other one on process, very, very broadly speaking. So one key concept that underpins inequity and inequality is marginalization, defined as the treatment of a person or a group or a concept as insignificant or peripheral. So as Hazel said, we know that much ANH research concerns itself with certain aspects of marginalization. So for instance, the disempowerment of women, or maybe disparities in income. But in previous work, what we thought we were seeing by looking at some of the literature is that food and nutrition research so far only has a partial treatment of equity and equality issues. So other kind of axes of marginalization, things like age, ethnicity, disability, sexuality, geographic location, seem to come up far less often in the ANH literature when we were looking at who had different outcomes. And crucially also the interactions between those different aspects of marginalization, what we call intersectionality, came up even less often. And then the structural determinants of marginalization, things like inequitable access to basic services or resources or political redressal, power relations and social norms, we saw those were coming up even less. So there was much less focus on equitable processes. So this is what we thought we were seeing, but we wanted to look at the literature systematically and see if what we thought was there really was there. And then in a separate piece of work done by my colleague Nick Nisbet and myself, we've been thinking about what these issues mean, what these equity issues mean, particularly for nutrition. So this framework of nutrition equity, it's one we've been working on for some time, and it's based on a well-established framework which describes the social determinants of health. And an updated version of this will come out in the Global Nutrition Report in April, because the Global Nutrition Report this year will focus on equity in nutrition. So very briefly, on the right, it includes more equitable distribution of outcomes among different population groups, achievement of which we could call nutrition equity. And then that's underpinned by a combination of food, health and care environments and people's exposures to these through their different material circumstances and behaviours. And you might recognise some elements of the UNICEF nutrition framework there, but in this framework, we focus explicitly on equity. So where this framework builds most on the UNICEF framework is in the sort of basic determinants on the far left, where we pull out the different aspects that relate most to equitable processes underpinning those equal outcomes. So for instance, someone's social position can be described through their personal characteristics, something like gender or ethnicity, but those are formed within a certain social context. So the social norms around the role of women, for instance, or around the position of different ethnic groups. And then these underpin someone's opportunities in terms of education and livelihoods, etc. And then connecting all of these into either more or less equitable systems are ideas of justice, unfairness, exclusion, and power. So you can read more about those ideas when the Global Nutrition Report comes out, but for now, just for this literature review, know that all those ideas on equity and equality really informed our conceptual framework for the work. So this is essentially the concepts and definitions used in this study. So in terms of equity, we classified papers according to whether they looked at, firstly, unequal outcomes stratified by those personal characteristics that might shape life chances. So things like poverty, ethnicity, age, gender, disability, geographical location, or the intersection of any of those. So that's the first kind of set of equity issues we wanted to look at. Secondly, we found papers that looked at a person's social position or material circumstances and how they make up someone's human capital and the resources available to shape their outcomes. So things like land or water ownership or access, market access, educational or knowledge disparities, and other material, social, human or natural capital that people might have. And then thirdly, we looked a bit at the structural determinants shaping the socio-political concept which underpins someone's social position and human capital. And the structural determinants of marginalization include things like social norms, so how different groups are seen in society, and their political voice, and the commercial context, and power differentials in any of those. And obviously the role of ideas and ideology and values shaping those. So those were the three levels of equity that we looked for: unequal outcomes, capital and resources, and those structural determinants. And we looked for those in the papers that we searched for, which I'll tell you more about in a moment. Then in terms of food and agriculture, we classified papers by whether they looked at primary production, sort of on-farm, value chains off-farm, food safety, food security, or the environment. And in terms of nutrition and health, we classified papers by whether they looked at diets, undernutrition, what I've called overnutrition, so obesity and chronic diseases, clinical health, occupational health, and environmental health. So that's kind of the conceptual framework for the study. It's how we searched for papers. It's also how we ended up mapping the papers, which I'll show you in a moment. So the broad question driving this study was, how does ANH research address equity issues in low and middle income countries? And within that, we also wanted to understand how different disciplines understand and research equity in ANH research, and how a focus on equity might have changed over time. So ours is a broad research question. It's one that hasn't been addressed in previous literature as far as we're aware. So the question lends itself to a process called a scoping review. So it's an approach to reviewing academic literature where the topic is broad rather than defined, and where a broad range of different research types might be relevant and might be available. We wanted to keep this very broad and say we'll look at any kind of ANH research that might include a focus on equity. So scoping reviews are quite a relatively rapid form of review. We look at title and abstract rather than the full text. And we aim to systematically gather and map key concepts and sources that underpin an area of research, in this case, equity in ANH research. And the idea is just to identify knowledge gaps that a research field, so all of you listening, might choose to address in future work. But the review doesn't necessarily try to assess the quality of the canon of that research or to draw further inference from it. So we're really just looking for gaps that we can then work together to fill. So this paper, or this presentation today, describes the findings of a scoping review on the treatment of equity in ANH research. And as with any good review, we've got the stages that we went through in the diagram that's just come onto the screen. So first of all, we searched 3 databases, CABI, Medline, and Web of Science, and we used those terms in the previous slide in order to conduct our searches. So the core agriculture, nutrition, and health terms, the equity terms, and also a set of terms related to low and middle income countries to limit what we were searching for. So we found over 26,000 papers through that process, and after removing duplicates, over 19,000 went for primary screening. So as I say, we screened them on title and abstract, and in order to be included, they had to include at least one aspect of food or agriculture, at least one aspect of nutrition or health, and at least one aspect of equity. And those things had to be linked, and they had to be within the analysis. So not just in the introduction to the paper or in the conclusions, they had to be a part of the analysis that the paper was trying to undertake. So we had inclusion and exclusion criteria, and we reviewed those and revised them over time through discussion among the research team. And we had initially 2 people undertaking the unenviable task of screening all of those papers, and then team discussion to resolve any differences. So after that initial screening, we had 338 papers left that seemed to be relevant, which went for mapping. So we used NVivo software to code each study based on its title and abstract again, according to our list of terms in the previous slide. So we mapped them to the ANH and equity criteria that I just showed. And that process was also a second screening. When we looked at them more closely, we found that maybe some of those should not be included. And so we ended up with 243 papers in the review. So we looked for papers between 2008 and 2019. And a lot happened in international food and nutrition in 2008. So that's why we thought it was a sensible year to start. So we had the first Lancet Under Nutrition series, we had the food price crisis, there was the Copenhagen Consensus report that put several nutrition interventions as the most bang for your buck in development intervention, and also the Commission on the Social Determinants of Health report, which did for health what we're trying to do for nutrition in terms of bringing equity into studies as a really core focus. So that's why we started in 2008 in our searches. And then the decade up to 2020 has led us to here. And this year, as I say, the Global Nutrition Report will focus on equity. So equity really has, over the last 10 years, become more of a focus in ANH research and its components. So between the start and end dates that we were looking at, the number of studies looking at any aspect of equity in ANH research increased quite steadily, from fewer than 10 studies that met our inclusion criteria in 2008 to over 45 in 2018. I didn't include 2019 here because the year was incomplete and it would have looked like there was a big drop. There wasn't. So these numbers, it's great to see them increasing, but when you look at the absolute numbers, you can see that they are a fraction of the total number of studies taken in the ANH research space over those 10 years. So equity in general, we found, is not a highly studied issue in ANH research. But for the rest of this presentation, I'm going to be talking about within the ones that we did find. So in terms of which disciplines are looking most at equity, we couldn't identify the originating discipline from the title and abstract for about a third of the papers, so this is incomplete data. But this shows that a majority of the identified papers originated in the fields of epidemiology, for about 27% of papers, and development studies, so about 18%, followed by economics and explicitly interdisciplinary research, about 9% each. And only about 3% of papers originated from agronomy and only 1 from demography by the metrics that we were able to generate. And then in terms of the approach to analysing ANH equity issues in the literature, most papers used primary data collection and analysis methods, so about 60%, followed by secondary data analysis of an existing data set of some description, about 19%, and then about 7% of papers did sort of theoretical analysis, so maybe creating a framework, something like that. And mixed methods were applied in only 1% of the papers that we found, and 13% were unclear in their methodological approach in the title and abstract. So just a sense of where some of these papers looking at equity in ANH are coming from. So in terms of the topics that were covered in these papers, within agriculture, a majority of papers looked at primary production. In fact, a vast majority of papers looking at equity were in the area of primary production on farm. That was followed by food security, then by value chains off farm, and then the environment, and food safety had very few studies, about 12. And then in nutrition, a majority of papers looked at undernutrition in its various forms, followed by diets, and very few, again, on aspects of what I'm calling overnutrition. And then within health, most covered aspects of clinical health or occupational health, and then a few looking at aspects of environmental health. So that's just a sense of where some of these papers are coming from. Within equity then, a majority of papers looked at capital and resources, so the money and assets that are available to people and how that differs and how that affects outcomes, nutrition and health outcomes from food and agriculture. That was followed by gender, so that was pretty much as we expected. Capital and resources, gender and poverty were the top 3 equity issues that are covered in ANH research. Next was some of the structural determinants, and that was a bit of a surprise to us because we hadn't seen so much of that literature, and then followed by age. And then other aspects explicitly looked at were disability and ethnicity, and very few papers looked at those. And very few, again, looked explicitly at the intersection between different aspects of marginalisation. In fact, only 2 papers looked at that sort of intersectionality issue. One looking at the intersections between gender, poverty and ethnicity in primary production and undernutrition, and one looking at the intersections of poverty, age and geography in primary production, and looking at multiple nutrition and health outcomes. So I think this gives a real sense of the types of equity that papers are looking at, and the types that really are not being looked at very much. And then just looking at a breakdown of equity topics by year, just to show trends, shows that capital and resources broadly has remained a very key focus of ANH equity work over time, along with gender, to some extent geography and poverty. And to a lesser extent, and in a very different set of literature, which I'll come to later, the structural determinants of equity. And each of those topics has remained popular, and the number of papers addressing them has broadly sort of grown over time. And the topics of ethnicity, disability, age, and intersectionality have been consistent in their low level of representation in the ANH equity literature. And then papers focusing on the core equity issues, things like marginalisation in general, have increased in the past 3 years. So this may be slightly confusing figure, which I'll talk you through, brings all that together. So it shows the density of research covering the different equity topics within each of the ANH topics. So within agriculture, which is the blue stuff on the left, a majority of papers focus, as I say, on primary production on farm. And of these, the main areas of equity focus are capital and resources, gender, poverty, geography, age, and the structural determinants. So you can see that those are the sort of darker, deeper blue colours. So that's how you read this chart. the deeper colours are a higher density of research. So within value chains, food security and environment work, the major focus has been on poverty, geography, gender, and again, capital and resources. And the food safety literature comprises fewer papers, but again, focuses on capital and resources and gender. So you can see some patterns. Within nutrition, which is the purple section at the top, a majority of papers look at undernutrition or diets, as I said. And for both of these, most papers assess capital and resources, followed by poverty, gender, and geography, with fewer looking at age. And for undernutrition, but not for diets, a significant number also look at those structural determinants. And of the very few overnutrition papers, they look at poverty, geography, age, and capital and resources the most. And then finally, within health, so that's on the right-hand side, the yellow sections, within clinical and occupational health, capital and resources again is most assessed, followed by gender, geography, age, poverty, and structural determinants. And of the very few environmental health papers, a majority look at geography, capital and resources, and poverty. So that's the detail, but just to summarize those different levels of equity, of the different aspects of equity mapped according to our conceptual framework, a majority of papers looked at unequal outcomes, not processes, but the outcomes, stratified by personal characteristics. So we had 185 papers that looked at those different aspects of marginalization like poverty or gender or age. And then another 20 that looked at core issues that just talked about marginalization without defining necessarily in what sense, and then 2 on intersectionality. So all of those look at those aspects of equity as an outcome. And then next, a significant number looked at social position or material circumstance, making up human capital and resources, and a smaller number of papers looked at the structural determinants of inequity, things like social norms and values. And within each subtopic under agriculture, nutrition, and health, fewer than 15% of papers looked at those structural determinants. So a summary just to clarify that. This scoping review, as I say, aimed to understand the range of ways that ANH research addresses equity issues among disciplines and over time. So within agriculture, the topic of primary production was best represented. Within nutrition, it was undernutrition and diets, and within health, occupational and clinical health. And the distributions of topics within each theme wasn't surprising. It's what we had expected. We had capital and resources, gender and poverty dominating the equity issues that are in this research. And that's in line, I suppose, with historical global development interests and funding. You know, we all know we need to put something about poverty and something about gender into our work. But it points to potential gaps among the other topics which researchers might choose to focus on in future research. So within equity, obviously a majority of papers focused on describing how nutrition and health outcomes differ for different groups who might be marginalized or differently affected by food system or agricultural activities. Very few of these papers looked at how different aspects of marginalization might interact. A significant number of papers went to the next level of understanding equity, looking at the material circumstances that shape people's life chances for those outcomes. And then an even smaller number looked at the most basic structural determinants of inequity, things like how norms and values or governance and institutions shape social or political marginalization. So most papers looked at what the inequity problem is, fewer looked at how this inequity is shaped, and fewer still looked at why the inequity exists in the first place. That's probably the best way to summarize what we found. So given the number of studies being undertaken in the ANH research space at all over the past decade, as I said, the total number found to explicitly incorporate any equity considerations within their core analysis, and clearly enough that it could be identified through our review, is really tiny. There aren't many papers doing that. It is heartening that the number is clearly increasing over time. But looking at the particular aspects of equity covered in the literature, the same aspects remain the least studied, things like ethnicity, disability, age, intersectionality, as well as the underlying and structural determinants of inequity remain the least covered. So given the role that inequity plays in holding back progress on a whole range of outcomes, we think really that understanding and addressing it at those multiple levels should be encouraged as a fundamental aspect of most future ANH research. I think you'd have to argue why you wouldn't do it rather than why you would. So clearly research on equity in ANH has largely been concerned with describing the problem in terms of which groups might have poorer outcomes in a different context as the result of known characteristics of marginalisation. And though researchers will have to assess which aspects of marginalisation might be sort of most relevant in the context of their particular research, systematic use of these sort of lists of equity characteristics, like the things I reviewed at the beginning, would at least ensure that most of those potential axes of marginalisation are considered. You know, will this be relevant in my research context, and therefore should I include it as something that I'm going to analyse? Should always be thought through. As I've said, the lack of papers looking at the intersection of multiple descriptors of those personal characteristics associated with inequity is disappointing, because we know that those different aspects don't act in isolation. So a younger woman of a particular ethnic minority, for instance, might be multiply disadvantaged compared to someone with none of those characteristics. So methods and approaches need to be refined or applied that allow researchers to understand how those interactions play out for different issues in different contexts. Beyond describing the problem, we found a significant amount of work that tries to understand how different groups are marginalised through limitations to their human capital or access to resources. And that aspect was looked at fairly consistently in around a quarter of papers reviewed. So it's relatively well covered in ANH equity research. But it should be noted that our review, and this is perhaps a limitation of the review, didn't differentiate between material capital, so things like wealth and assets, and less tangible forms of capital such as social or human capital like education or social networks, which are also likely to be important in understanding inequity. So that both of those are sort of lumped together in our review. And then the topic of structural determinants, so those social norms, commercial contexts, and political voice shaping equity at the most fundamental levels, it was better covered in the literature than we'd expected, given the dominant discussions in the ANH research and funding world currently, at least those that we're aware of. But much of that structural determinants literature was undertaken in disciplines that traditional ANH work does not do well at engaging with. So disciplines like sociology or political science that a lot of people working in the ANH space don't read. So that literature can inform approaches that work at those fundamental levels for sustainable change. And I think the ANH research and funding and practice communities would do well to better engage with some of those literatures. So, I mean, if we don't attempt to understand and to address those sort of deeper social, political and commercial structures that underpin inequity, food systems and agricultural systems are going to be left to reproduce the same outcomes, and the same groups are going to continue to be left behind. So I'll be happy to talk more about the limitations of this work in the Q&A and give any more detail on the methods and findings, but just briefly in terms of sort of next steps for this work. So obviously this review is just a first step in identifying relevant literature and starting to understand the gaps and limitations of the field in assessing and understanding and even acting on inequity in agriculture and food systems as they relate to nutrition and health. And the idea is that further work can now be done by taking this literature and looking in more depth at particular aspects that interest different research groups in order that some of those knowledge gaps can be filled. In taking forward that kind of agenda, obviously it would be wise not to ignore this sort of epistemological divide separating different groups of ANH equity researchers. So some people are going to be comfortable disaggregating quantitative data by aspects of marginalisation. Others will want to go deeper to understand how the structural, social and political determinants interact in food and agricultural systems to create those outcomes differently for different groups in different contexts. And obviously, you know, a live and let live approach with some willing to sort of cross-fertilize ideas among different groups will probably make for the richest contribution. But I think all of us should be thinking, what can we do to include equity in our research, whatever type of research it is? So next we plan to publish these findings as a paper, which will obviously take a little bit of time, but in the meantime we also want to make available to the community the list of papers that we found, as well as how they mapped to the different areas that we were looking at. So this sort of dotted picture on screen that you can see is a section of the Excel file that we'll make available, and you can see that for each reference it tries to tell you what the approach and discipline were, but then also which aspects of equity and ANH we discovered in the paper. So people, if they want to work on sort of age in primary production and look at undernutrition outcomes, can look at the subset of papers that are available on that in order to see where the gaps are that they might want to fill. So we'll also share that and a reference list so that others can follow up and prioritize research to fill some of those gaps. So these slides will be available. So there are a few references and further reading there just on equity in general. And I just want to say thank you, obviously, to our funders and to colleagues who have helped us to frame this work. Thanks to A4NH for hosting the webinar and to everyone for attending. So I'll hand back to Hazel and I will attempt to answer some of your questions. Thank you.
Great. Thank you so much, Jody. So thank you for the presentation. As we mentioned earlier, everybody is in listening mode. So if you have comments or questions, please share those through the chat box. And while we're waiting for questions to come in, I had a couple of questions for you, Jody. So one of the things that struck me is you sort of started out with the definitions of equality and equity, and that these were contested concepts and that they were sort of difficult to pin down. In some of your discussion in the results, you talked about how many of the papers talk about inequalities in outcomes. And so I was wondering how I feel like there's still that confusion around, are we really talking about equity, or are some of these papers all talking about equity enough, even though they've been included in this review, or are we still, is it just looking at equality? And yeah, so could you clarify that, because I feel like I'm still a little bit confused.
I'll certainly try. So I mean, as I say, I think different people define this stuff in different ways. So I think it is we tried to be inclusive. If people, you know, thought they were doing work on equity, we didn't want to say they weren't. You will never get to complete equality of outcomes, right? Because it's not just these sort of social structures and things that shape that. There are also, for instance, in nutrition and health, there are personal choices, for instance, to smoke or eat unhealthy foods. There are also genetics involved. So you'll never get to sort of perfect equality of outcomes. So what we tend to talk about is greater equity in outcomes. So we try and think about, how do we move towards people not systematically being marginalized in terms of those outcomes, just by dint of things that they have no control over, things that would be unfair. So I think, to me, a lot of what equity should be is focusing on those sort of, if you think back to that framework that I presented close to the beginning, the stuff on the left-hand side of the framework, the kind of structural issues that shape whether a person even has a choice over a lot of those outcomes. But yes, I think a lot of this work is looking at inequality of outcomes, but I think we do need to include those in this kind of work, because it's looking at it as a whole. You need to think through, okay, if for instance women are systematically getting worse outcomes, it's important to know that in order to then think back to what the equity considerations are underpinning them. So I think equality of outcomes and equity are inextricably linked, and we have included both here, but you could argue that one is equity and one is inequality.
Okay, that's very helpful. Thank you. So we have another question sort of around methodology. Did you encounter any novel methodologies that different researchers used in doing the review? And how might these novel methodologies push equity studies forward in future research?
Okay, that's a good question. So we didn't map methods or approaches that these studies were using, but I know that the gap map by the Imana group has explicitly looked at some of these kind of methods and metrics for looking at some of this stuff. So if it's methods and metrics that you're looking for, the Imana gap map is probably a good place to start. We were looking at topics, we were looking at who's researched what. So I think the next step would be, if you're looking to analyze some aspect of equity, a particular one, you could certainly look at our mapping, that colorful checkbox thing that I showed you on the last slide, and you could go to those few papers and see what methods they had used, or you could go to the gap map. But it wasn't something we were explicitly looking for, because a scoping review is just trying to get a sense of what's out there. We didn't look at how people were doing this. We didn't look at the quality of any of this work. We just wanted to see what was out there.
Okay. So great. So we have some questions pouring in. I think there was one question that's asking differentiating between equity and inequalities, but I think we already covered that in the first question, so I'm going to jump ahead to some of the others. So Justine Kavle says, very interesting presentation. Can you comment on how this body of work can inform program design and implementation for ANH?
Yes, I think the reason that we research these things is probably in order to later intervene, right? Either through policy or through programs. So I think the fact that certain things are looked at and certain things are not looked at has implications, right? Because if there's a whole huge body of evidence on, for instance, gender in ANH research, that might tell people that the most important thing to implement on is gender. Now, gender is a very important aspect of ANH. We know that because we have the evidence on it. But just because there's no evidence on the role of ethnicity or the role of different ages, you know, the elderly or the young, or just because there's no evidence on that doesn't mean that it's not important. So I think both researchers and implementers and policymakers need to think through, for their particular context, what are the equity issues that are important in this context? And in some places, in some types of work, that might just be as much as thinking through that list of aspects of equity which shape outcomes. So that, you know, poverty, disability, gender, age, etc. And thinking through, you know, who do we know are the marginalized groups in this particular context? And then depending on the implementation, depending on the program or the policy area, you might want to also think further towards the left of that equity framework that I showed you and say, okay, do we actually need to be working on something like social norms around the role of women, or how certain ethnic groups are politically marginalized? So that will depend on the type of intervention that you particularly do. But I do think that the evidence is important, but a lack of evidence doesn't mean that an issue isn't important. It just means it hasn't been assessed enough. But I think that same sort of framework and the same list of of marginalization or equity issues can be thought through both for researchers and for implementers to say, okay, what is it that's important in my particular context for the outcomes I'm interested in and for the populations I'm working with that might bar them from accessing the services I'm providing or from taking part in the program that we're offering. So thinking that through with an equity lens, I think is highly important for both groups.
Mm. Okay, so just to follow up on that, I think that's a really important point because you're pretty much describing how researchers interested in this can take this forward. So just to summarize what I heard, one aspect is around the framework, which I thought was really interesting and useful because that helps researchers kind of figure out where the issues that matter might lie, and that these could vary by context, by intervention, depending on what area we want to focus on. And then on top of that, having the mapping, I think, is also really useful because basically you've already done the first kind of crack at taking a look at what's out there, and having identified, areas where there are gaps and areas that are sort of better represented in the research versus less represented in the research, I think is already kind of a useful starting point. So that's great. One thing that comes to mind is you mentioned youth, and having heard so much about youth, like interest from the donors and in our own institutions, I was amazed at how that emerged as something that's still, I mean, I guess I would have expected that it had been better represented. What do you think is going on? Is it because it's so new, or that things have not yet been published, or are there
Yeah.
other constraints that researchers are facing around these understudied areas? Well, I mean, because if we're in the business of trying to sort of help researchers do a better job at addressing these issues, then what can we do as a research program, for example?
Yeah, so I'm pretty sure you're right in terms of the focus on youth that some of us are seeing is sort of new, and so those papers wouldn't have filtered through yet. I imagine that's what's happening. But the broader point that I think I'd like to make is we keep getting hung up on one aspect of equity. So first it was poverty, then it was gender, now maybe it's youth. I'm not saying the other ones go away, but we jump on one sort of aspect of equity, but that aspect may or may not be the most important one in a particular context. So having a framework or a set of, even just a list of those different aspects of equity in your head or in front of you is important in order to think through for your context, be it a piece of research or a program design or a piece of policy that you're thinking of doing, thinking through, which of these in my context is sort of most important because of the specific sort of social and political and commercial context that I'm going to be working in, and not just saying, okay, well, we're going to do youth because youth is the thing that everyone says is important today. It may well be highly important in a lot of contexts, but it's probably not the only thing that's important. So for instance, a young woman of a particular ethnic group might be multiply marginalized in a particular context. So my sort of thoughts there are around thinking of equity in its broadest sense that you can possibly manage given the constraints of whatever program or research you're doing, and trying, even if you're sort of going for a funding call, let's keep it really practical, even if you're going for a funding call that requires that you look at youth, for instance, to frame youth as one aspect of equity that might be important in your particular issue or context, and to always try and broaden it out to those multiple issues of equity that might be important, and where you can, broadening it out to the sort of underlying and structural determinants of why those people are marginalized in the first place. So any of these single aspects, be it gender, be it youth, be it whatever it is, let's try and think of them as aspects of equity and not just as single issues, which is how we keep sort of applying them.
Right. That's a really good point. So we got another interesting question from Edita Ampere. I did not see any mention of policy in the categories. How is the role of policy conceived since it cuts across all categories?
So I guess policy can address any of those issues. So you can have a policy that explicitly says that a certain ethnic minority group gets social protection or schooling in a certain way. You can have it address various of those aspects of marginalization through social transfers or through trying to change the social norms. So I guess policy would be in my thinking, would be a sort of next step. Now, one of the next thing we're actually doing with this research is taking this list of 243 studies, and Amanda Wyatt at IFPRI and I are leading this second sort of subsequent study, which is looking at whether any of these studies address governance in its broadest sense specifically. So we will be taking that list and looking at whether any of it is a particular analysis of a certain policy and what that policy has done for equity. So it's a good question because it is actually our next logical step. But we don't see, it wasn't the aim of this initial study to talk about the role of policy.
Okay, and great plug for the subsequent papers coming out of this work, so thank you.
Right.
Okay, so we have other questions. Let me see. So maybe this is a bit related, and maybe this can be brief. Should policy or programs be small scale and focus on marginalized populations, or should they include them in the majority of the population?
I think
What
the question of scale is I mean, it's a really interesting one because the bigger scale you get, the sort of less detail you can generally include in a program. But I don't think it's an either or. You know, we need some big picture policy interventions to level the playing field for different groups, and we also need some very locally targeted, locally understanding, locally nuanced programs. And so I really don't think it's an either or. I think learning across those different scales on what works for equity is going to be the most important thing.
Yeah, and I guess that goes for all. I mean, just thinking of gender research, I think it would kind of be the same, right? That you need understanding across all levels, because they give you kind of different insights. Okay, so oh, okay, we got a comment from John, so let's see. So you highlighted the gap of social determinants of nutrition and health outcomes. These are clearly a subset of outcomes from broader social norms, commercial processes, etc. Could you comment on whether nutrition and health should link with broader socioeconomic development processes and link ANH research to broader socio-political processes in countries?
So I think this sort of mirrors what we just said about scales. I mean, I think that there is a development argument, right, that we shouldn't focus on any particular development issue like nutrition or health or agriculture. Rather, we should just try and deal with these big structural determinants of why certain groups are marginalized. And if we deal with that, we've sort of dealt with everything. But there's another school of thought that is, well, if you don't focus on something like nutrition, for instance, being the thing I know best, it tends to sort of fall through the cracks and get lost. And maybe that sort of big picture stuff works in the long term, but in the medium term, you need that more detailed focus, the smaller scale stuff to help those people. So yes, absolutely. I think we should link more with people doing this sort of bigger picture research on marginalization and social norms and social determinants. But I don't think we should only do that. I don't think we should lose the sort of specific focus, and ANH has sort of stood the test of time as a set of issues that are interlinked enough that they're sensible to look at together. So yeah, but I do think, you know, there are people out there, and we found, what was it, 51 papers in this study looking at ANH and the structural determinants. There are people doing that work, but when you have a quick look through the list, it's really a very different set of people than are doing the sort of classical ANH research, looking at, you know, different marginalized groups by those outcomes. So I think we need to read each other's literature. I think we need to engage with each other's disciplines. And I do think we need to sort of understand the different approaches to looking at these issues and make the links, but not say that one or the other is more important. They're both important, and the sweet spot comes in the interplay between the two, I think.
Okay, great. And you actually just answered my next question, which is around what are we going to do to sort of engage with that sort of a whole set of other literature that seems to be distinct from ANH, what most ANH researchers are working on.
Yeah,
so
and it is tough because different people are trained in different disciplines, and sometimes even don't see different types of research as valid or useful. So
right.
I think sort of engaging, or at least trying to read, just have a look through this Excel file that we're going to make available. And if you're someone who doesn't do a lot of work on those structural determinants, choose a couple of papers that are mapped to that and have a look and see what you think. And conversely, if you're working on the structural determinants but you don't really see yourself as working on ANH, you might not be on this call in that case, but maybe have a look at some of the economics or epidemiology papers, because usually in doing things like that is where fresh insights come into different disciplines working on these really important issues, and where we get these sort of great leaps forward. So I'm a huge advocate of engaging with different literatures and disciplines just to see if there's anything that they inspire you with.
Yeah, I lost you for a second there, Jody, but I think you were wrapping up your sentence. So I think it should be okay. Okay, so we have one question around health. So Catherine Rebe, I'm sorry if I'm mispronouncing your name, is asking, were the social determinants of health covered in any detail? So maybe just say more about how that's treated in the paper.
Yeah, so the social determinants are the stuff on the sort of left-hand side of that framework. So the framework that I showed you, the sort of colourful one with arrows and things, was the social determinants of nutrition, but it was taken explicitly, adapted from the WHO social determinants of health framework. And so if any of the health-focused papers looked at those social determinants, we would have mapped them as the structural determinants, and so they will be easily spottable in that Excel file. So they'll be mapped to both one of the health outcomes and to the structural determinant stuff. The structural determinants and social determinants, I guess we were using kind of interchangeably. Yeah, so I think the social, political and commercial contexts are what we're defining as the social determinants of health or nutrition, and we're looking at specifically in the context here of food and agriculture systems, but it can be looked at more broadly.
Okay, so Anne-Marie Mayer wants to know, did you find studies where communities themselves identify and prioritize the equity issues themselves through participatory methods of some kind? That's very interesting.
Hi, Anne-Marie. So we didn't look at methods, so we wouldn't be able to say whether participatory methods were used in any of these. It's perfectly possible that they were, in fact likely, because I think a large proportion of the papers emanated from what we've called development studies discipline. But you'd have to go and have a look at the papers yourself to see if any of that subset were using participatory methodologies. I couldn't tell you that from this review. But the papers will be there to be looked at.
Okay. Tatiana Gumucho wants to know, well, first, thanks you for the presentation, and asks, could you comment more as to changes over time in the types of research questions guiding investigation on equity in ANH per the review? Additionally, do you see processes related to climate variability and change being considered more? And if so, how?
Okay, yeah, so we didn't sort of map the specific questions that studies were looking at. We were looking more at the topics of those studies. But climate is a particularly interesting one because we had a lot of discussions about where it would fit within our categorization. So climate could be an aspect of agriculture. So we could have mapped it as ticking the agriculture box in terms of our inclusion criteria. But climate more and more is also an equity issue, right? It hits certain groups or certain geographies harder than others. And in some papers, climate was used not as a sort of agricultural technical issue, but as that sort of equity issue, looking at climate in that way. So climate was interesting there, and I think there we mapped it as a structural determinant of these outcomes. So climate definitely was there in a lot of the papers. Because it wasn't mapped separately, I couldn't tell you if it's increasing over time. I can only guess that it was. But it's interesting that climate was used in those two different ways. So yeah, I would suggest that you can search through those papers to look at ones that look at climate and see what you find if climate is your area of work.
Okay, great. So I think we've covered most of the question. We do have one final question, which might be a good one to wrap up on, unless if there are other questions, please. We still do have a bit of time, so if you like, you could still send us some questions. Megan wants to know when and where will the Excel file be available? And I guess I can answer this question, because there will be a blog post that will be circulated after this meeting, with the recording, the slides, as well as the Excel file. And so that will be made available very soon. So please keep posted. And I want to switch back to our organizer to ask about, do we have any other questions or that I've missed, or are we ready to wrap up?
At this time, we don't have any more questions. So I'm going to go ahead and echo what Hazel had just said about what will follow up from here. We will be in touch shortly with the recording of today's presentation and slides, along with that summary blog. The Excel file will be attached to it. We're going to assemble those pieces and get them posted to the A4NH website. We'll be able to reach you all by email to let you know when that's available. But you can also keep an eye on our website, and as on the slide on the screen here, you can follow us on Twitter at A4NH_CGIAR. We'll make the announcement there as well. So at this point, I think on behalf of A4NH and the IFPRI Gender Task Force, I want to thank you all for participating in today's webinar and for contributing to such a rich discussion on this important topic. We will be in touch soon, and have a great rest of your day.
Thanks all.
Thank you, Jody, and thanks everyone.
Thanks for having me.